Hello, my name is Lisa Hord, and I am Superintendent of Claims here at the NALC Health Benefit Plan. This presentation will give you an overview of our 2023 prescription drug benefits. Thank you for taking the time to view this presentation. CVS Caremark has been our pharmacy benefit manager for nearly 25 years. Pharmacy spend is the largest expense for a health insurance company, so it's important that the plan partnered with a company that not only understands the needs of our members, but who will help work to keep costs low. One benefit of the long-term partnership with CVS Caremark is that we have been able to keep your out-of-pocket costs the same for many years and even lower the cost of medications for individuals with hypertension, diabetes, and asthma. CVS offers the option of picking up your medication in one of more than 68,000 store locations or using the mail order program. Let's start off by highlighting our new prescription benefits for 2023. Beginning on January 1st, we will cover FDA-approved prescription weight loss medications that have been approved through prior authorization. The plan will also cover prescription drugs for the treatment of infertility, limited to a maximum plan payment of $2,500 per calendar year. Call CVS Caremark at 800-294-5979 to obtain a list of covered weight loss medications or to obtain prior authorization. Please also note that for diabetic members who require the use of a continuous glucose monitor, or CGM, both the transmitter and supplies can now be ordered directly from your local in-network pharmacy. You may fill prescriptions at a network pharmacy, a non-network pharmacy, or by mail. You always get the best benefit when you purchase prescriptions from a network pharmacy, but you may purchase prescriptions at pharmacies that are not a part of our network. Just please keep in mind that if you do purchase prescriptions from a pharmacy not in network, that you will have to pay the full cost and then file a claim for reimbursement. Visit our website for more details. To locate the nearest in-network pharmacy, call 800-933-6252. For prescriptions purchased at NALC Care Select pharmacies, you may obtain up to a 30-day fill plus one refill. If you purchase more than two 30-day refills of a maintenance medication at a network pharmacy without getting any type of prior authorization, you will need to file a paper claim to receive reimbursement at 55% of the plan allowance. Maintenance and long-term medications may be ordered through our mail order prescription drug program for up to a 60-day or 90-day supply. You may also purchase a 90-day supply of covered medications and supplies directly in person at a CVS Caremark pharmacy through our Maintenance Choice program. You will pay the applicable mail order copayment for each prescription purchased. The NALC Health Benefit Plan's prescription drug program, provided by CVS Caremark, classifies prescription medications into four categories or tiers based on quality, safety, clinical effectiveness, and cost. Your cost share is based on the tier level of your prescription drug. Our tier levels are defined as Tier 1, prescription drugs that are generic; Tier 2, formulary brand drugs, which are brand name drugs that appear on the plan's formulary; Tier 3, non-formulary brand drugs, which are brand name drugs that are not listed on the plan's formulary; and then Tier 4, which is our specialty drug medications, which always require prior authorization. Now let's describe what formulary means. So formularies are developed by an independent panel of doctors and pharmacists who ensure medications are clinically appropriate and cost-effective. Our formulary list is called the NALC Health Benefit Plan Formulary Drug List with Advanced Control Specialty Formulary. Certain non-formulary drugs may only be covered with prior authorization. If your physician believes a brand name drug is necessary, or if there is no generic drug available, ask your physician to prescribe a formulary brand name drug from the list. You will pay the appropriate retail coinsurance and mail order copayment amounts for generic and formulary brand name drugs on the list. Your out of pocket costs will be higher for non formulary drugs that are not on the formulary list. To obtain a list of formulary drugs, please visit our website at www.nalchbp.org or call our customer service department at 888 636 6252. Please see our official brochure for details on this benefit. Generics can reduce your out of pocket costs. Ask your medical professional to prescribe you a generic drug. Although the cost difference can be dramatic, generic drugs are pharmacologically identical to their brand name versions. The FDA requires that generic drugs be as safe and as effective as brand name drugs. Call CVS Caremark at 800-933-6252 to see if your brand name drug prescription is available as a generic. The plan requires prior authorization for certain drugs to ensure safety, clinical appropriateness, and cost effectiveness. Prior authorization criteria is designed to determine coverage and to help promote safe and appropriate use of medications. Specialty drugs and medications for anti-narcolepsy, ADD, ADHD, certain analgesics, certain opioids, 510K dermatological products, artificial saliva, and weight loss drugs require prior authorization. In certain circumstances, a prior authorization may require the trial or step of a more appropriate first-line agent drug before the drug being requested is approved. To obtain a list of drugs that require prior authorization, please visit our website at www.nalchbp.org or call our customer service department at 888 636 6252. Once again, please see our brochure for official details on this benefit. Maintenance medications in the high option plan can also be obtained for low copayment amounts. Generic medications have copayments ranging from $5 to $15 for a 90-day supply. Those members that have asthma, diabetes, and hypertension, or that have Medicare Part B as their primary payer, may pay an even lower cost of copayment amounts for their medications. Let's first take a look at our high option prescription drug benefits. Our next slide will review the CDHP and value option prescription drug benefits. First is generic drugs. So for network retail, up to a 30-day supply, you pay 20% of cost, and then of course the cost is lower at 10% of cost for asthma, diabetes, and hypertension. Mail order generic drugs up to a 60-day supply, you pay $10. For mail order for a 61 to 90-day supply, you pay $15. And again, we have a lower cost of $8 for drugs that are generic related to asthma, diabetes, and hypertension. For formulary brand drugs, at network retail up to a 30-day supply, you pay 30% of cost. For mail order up to a 60-day supply of formulary brand drugs, you pay $60. For mail order for a 61 to 90-day supply, you pay $90. And again, at a discount benefit to those members that have asthma, diabetes, and hypertension, that copayment is reduced down to $50. Next is our non-formulary brand drugs. For network retail, up to a 30-day supply, you pay 50% of cost. For a mail order, up to a 60-day supply of non-formulary brand drugs, you pay $84. And then lastly, for mail order for a 61 to 90-day supply of non-formulary brand drugs, you pay $125 or the discounted amount of $70 if the drug is related to asthma, diabetes, or hypertension. Last in our list is our specialty drugs, which are available through CVS Specialty mail order only. For up to a 30-day supply, you pay $200. For up to a 60-day supply of specialty drugs, you pay $300. And then for up to a 61 to 90-day supply, your cost is going to be $400. Next, we're going to take a look at the prescription drug benefits for our CDHP and value option plans. Under these plans, you have the choice to order any medications you choose for chronic illness through our mail order program, or you can pick up again your 90-day supply in person at a local CVS pharmacy using our maintenance choice program. As with your medications, if they're purchased at an in-network pharmacy, you you also get the best benefit. But for the CDHP and value option plans, just remember that you must meet your deductible before the plan pays their portion of the drug cost, or use funds available in your PCA or personal care account to cover your cost. A 90-day supply of your generic medication is $20 under the CDHP or value option plan. Formulary brand is $90 and non-formulary brand is $125. So let's look at this slide and just take a look at the details of your cost for the medications under the CDHP and value option plans. So for generic drugs, network retail, up to a 30-day supply, you pay $10. And please note that for our CDHP and value option members, for those that have hypertension, diabetes, or asthma, those drugs are also available to you at a lower cost. So you can see that the cost goes down to $5. For generic drug mail order, a 90-day supply, you pay $20. And then again, you have a lower cost of $13 for asthma, diabetes, and hypertension. For formulary brand drugs, network retail, up to a 30-day supply, you pay $40. For mail order 90-day supply of a formulary brand drug, you pay $90, or if related to asthma, diabetes, and hypertension, that cost is lowered down to $70. For non-formulary retail, up to a 30-day supply, you pay $60. For mail order, non-formulary brand drug, for a 90-day supply, you pay $125. And then if you have a medication for asthma, diabetes, or hypertension, that medication is lowered down to $110. For specialty drugs, through the Caremark Specialty Mail Order Program, 30-day supply cost for you is $250. And then for a 90-day supply of specialty drugs, the cost that you pay is $450. Please note that for non-network retail medications, you will pay 50% of the plan allowance and the difference, if any, between our allowance and the billed amount. CVS Caremark does not just handle our prescriptions. They also provide other services and wellness programs to our members. There are several programs they offer to assist you with your healthcare needs. First, we have the Complex and Chronic Disease Management Program, which helps individuals with complex illnesses such as Crohn's disease, multiple sclerosis, rheumatoid arthritis, or cystic fibrosis. It helps these members dealing with these chronic conditions to live and manage their conditions. Next is the Transform Care Diabetes Program. This helps deliver overall care and lower costs for our members that have diabetes. Your enrollment in this program includes a connected glucometer, unlimited test strips and lancets, medication therapy counseling from a pharmacist, and then you also receive 2 annual diabetes screenings at a CVS Minute Clinic and a suite of digital resources that are available through the CVS mobile app. And this is all at no cost to our members. Please call CVS Caremark at 800-933-6252 for more information on this program. Next is the Hello Heart program, which is new for 2023. Do you have high blood pressure? Our new program, Hello Heart, is essential for any of our members who need a tool to assist with the remote care of their cardiac conditions. This program enables you to measure your blood pressure using a free FDA cleared monitor and allows you to send data privately to your doctor and physician. This program empowers you to improve your lifestyle through coaching on your smartphone or tablet. You will have access to the most advanced hypertension management tools on the market, all at no cost to you. Text NALC to 75706, or you can visit the website at www.join.helloheart.com/NALC to register. Last but not least is the Enhanced Caremark Direct Retail Program. You can purchase non-covered drugs through your local CVS pharmacy and receive the convenience, safety, and confidentiality you already benefit from with covered prescriptions. Our Enhanced Caremark Direct Retail is offered at no additional cost to you. Using this program at your local CVS pharmacy, as well as all major chains for both covered and non-covered prescriptions, helps ensure overall patient safety. This program allows you to get a discount on many prescription drugs that are not covered by the prescription drug benefits. Enhanced Caremark Direct Retail is a value-added program that provides you with safe, convenient access to competitively priced, non-covered prescriptions and certain over-the-counter drugs. You may call 800-933-6252 24 hours a day, 7 days a week for a complete listing of available medications and their costs. Since the plan does not own our own pharmacy benefit, we must enter into trusted partnerships with vendors like CVS Caremark to complete our benefit package. We strive for partners who can help the plan grow and that can work with us toward fulfilling our mission of providing our members accessibility to quality medical care while maintaining a comprehensive benefit package. Our long-term relationship with CVS Caremark shows you just how much we trust them in helping us fulfill our mission. I'd like to thank you for taking the time again to view this presentation. If you have any questions, please do not hesitate to reach out to our dedicated team of customer service representatives at 888-636-6252. Thank you so much for upgrading your health to a union that delivers.